Mr.
Speaker.
I call in Lees-Galloway.
Thank you, Mr. Speaker. When the Prime Minister delivered his statement last Tuesday, he was at great pains to insist and to convince us that he had a plan. And every government member who has got up and spoken since then in this debate has insisted to us that they have a plan. John Key has a plan. Well, where is this plan? Where is the plan? This plan is so secret. This plan is more secret, Mr. Speaker, than the activities of the SAS. We know more about what Willie Apiata is doing in Kabul than what the Prime Minister is doing for New Zealanders. There is no plan. That is becoming more and more apparent. If there was a plan, if the government was serious about doing something for this country, then the plan would be about relieving unemployment. A few weeks ago, we saw some stunning statistics, and I think John Key and the government were actually quite taken aback by this, at just how much unemployment has gone up in this country since they came to government. And that's right, 15.4% of Māori. In my electorate of Palmerston North, it is now at 8.2%. That doesn't sound an awful lot next to 15% of Māori, but it is very high for our region. It is higher than the national average, and that's actually very unusual for our region to pop up above the national average. So where was John Key when the unemployment was rising? Where was his plan? What was he doing? Well, he was probably talking to himself in the mirror, congratulating himself on being voted the sexiest politician by a condom company. But that's kind of appropriate, isn't it? Because he wasn't brought in to lead. He was brought in to be the smiling, waving, acceptable face of the National Party. And he smiles and he waves as jobs get cut. Jobs like frontline services in my electorate at Mid-Central District Health Board. Jobs like delivering diabetes intervention and support services. Because, Mr. Speaker, when it comes to healthcare, this government doesn't have a clue. There is an old saying, it's common sense, it's a bit cliched, but a lot of common sense sayings are, and that is that prevention is better than cure. But prevention is well and truly out of fashion with this government. Any program that teaches people to take control of their health, to take control of their lives, has been cut. Healthy eating, healthy action, cut. Fruit is out, pies are in. Targets to reduce obesity, to maintain good oral health, to vigilantly monitor the mental health of our communities, all cut. Every single one. Prevention is out of fashion with this government, and what do we get instead? What do we get instead? Surgery. That's what they're focused on. When it comes to obesity, what's the latest plan? Stomach stapling, gastric bands, gastric bypass, whatever you want to call them, the answer is the same, and that is basically take no personal responsibility. We're not going to help you take any personal responsibility. We're not going to help you out. But maybe, if you're lucky, we might offer surgery further on, further down the track. And why is it that the government is so obsessed? Why is it that the government is so obsessed with surgery and this curative instead of preventative approach to healthcare? Well, it's easy to measure. That's why. They're not looking for ways to improve New Zealand's health. They're not looking to improve population health. They're looking for things that are easy to measure. ED waiting times. I haven't met a single clinician who thinks that ED waiting times is what we should be focusing on, but it's easy to measure. Immunisation, actually quite a good thing. Thank goodness. Immunisation is easy to measure because the government has stuck with it. Smoking cessation, again, easy to measure. Not the best approach. We should be preventing people from taking up smoking. But smoking cessation, again, you can say, you can tick the box, give an extra piece of paperwork to the nurses and doctors and the frontline healthcare workers and say they've done their bit on smoking cessation. Now, the House knows that I have an interest in preventative strategies on tobacco. And one of those areas that I have an interest in is tobacco displays. Now, Scotland has recently banned tobacco displays. The UK has banned tobacco displays. Canada has banned tobacco displays. And yet, for some reason, we continue to drag our feet in this country. Why? Because it's a difficult to measure, preventative measure for trying to deal with long-term health issues. It's actually Tariana Turia's preferred approach. The minister who's responsible for tobacco control in this government, who doesn't get a say, obviously, her preferred approach is down the gurgler as long as Tony Ryle's in charge. And the other area that we've been talking a lot about trying to prevent people from taking up smoking, is tax. Now, wouldn't that be ironic if this government's first move to try and curb smoking rates in this country was to increase tax? This from the government that absolutely rock-solid promised not to increase GST before the election. Oops! There's another broken promise. There's another broken promise. But hang on, they did say they wouldn't have to increase GST if they were doing a half-decent job. So finally, an admission from John Key that he's not actually doing a half-decent job. But I think we should actually explore the issue of taxation as a tobacco control method, but only if the government...
Sorry to interrupt the honourable member, but the time has come for me to leave the chair. This debate